Hi everyone, I hope you've been finding the Pause Ed app helpful to you as you navigate your way to recovery from your eating disorder. In this video, I would like to discuss one of the most common health issues associated with eating disorders, namely an electrolyte imbalance in the blood. Specifically, I would like to discuss hypokalemia, which means low serum potassium levels. Potassium is the most abundant cation in the cells of the body and is therefore essential to the life of the organism. A normal or balanced potassium level is integral to normal cellular function, particularly of nerve and muscle cells, and this includes the muscle cells of the heart. And it is tightly regulated by specific cellular pump networks. Potassium is obtained through the diet and excreted principally via the kidneys. Hypokalemia is generally defined as a serum potassium level below 3.5 millimolar per liter. The unit millimolar per liter simply refers to the concentration of potassium in the blood. The normal potassium concentration range is between 3.5 and 5.0 millimolar per liter. Severe hypokalemia is a concentration level less than 2.5 millimolar per liter and may manifest as bradycardia or decreased heart rate with cardiovascular collapse. Cardiac arrhythmias and acute respiratory failure from muscle paralysis are life-threatening consequences that are possible with severe hypokalemia. Overt early symptoms of hypokalemia include weakness, fatigue, muscle cramps, constipation, and, as I indicated, cardiac arrhythmias. Low potassium has many causes, with the majority of them being related to an increase in the urinary excretion of potassium. Less common are deficiencies due to decreased potassium intake, although patients with anorexia nervosa run the risk of low potassium intake. In the world of eating disorders, decreased serum potassium is frequently associated with laxative abuse, excessive use of over-the-counter diuretics, and frequent vomiting as seen in persons with bulimia nervosa. Excessive alcohol consumption can also be a cause of hypokalemia. Vomiting and laxative abuse result in gastrointestinal changes that favor the excretion of potassium and thus lead to severe hypokalemia. Of patients taking non-potassium sparing diuretics, 20 to 50% of these patients will develop hypokalemia. The incidence of hypokalemia in patients with an eating disorder has been shown to range from 5 to 20%. In addition to potassium supplements, and in severe cases intravenous administration, certain diet modifications can be helpful in restoring potassium levels. For example, high sodium intake leads to increased renal potassium losses. Therefore, a low sodium diet is recommended. In addition, potassium-rich foods such as bananas, tomatoes, oranges, and peaches are recommended. Hypokalemia is too frequently an indirect cause of death in patients with eating disorders due to the impact of low potassium on the heart. So please, be aware of this particular long-term guarantee and take it into consideration during your pause before engaging in ED. Enjoy your life and value the precious moments that it gives you. Take care.